All right. So recording is now in progress, and I will officially welcome you. Welcome to Talking Data Equity. My name is Heather Kraus, and I'm coming to you today from Toronto. And we are gathering together like we do most Fridays for an event called Talking Data Equity. Talking Data Equity is an informal conversation amongst people across the world, across sectors, across disciplines who are trying to find ways to make choices and use tools in the data products that we're consuming or the data products that we're producing that align with the human values and the human priorities that we have for those data projects. And when I founded We All Count many, many years ago, I had still a lot left to learn. I still have a lot left to learn. But one of the things that I've learned is that one of the biggest kind of barriers to making real progress for a lot of people professionally with data equity is that feeling of being alone, feeling like maybe you're the only person in your team that gets data equity or that cares about data equity, or feeling like there are people around you who are making your life harder. And so we formed data equity so that there was a place where even if you were the only person on your team, or even if you are a team of one, you can come and you can know that you are genuinely not alone. There are lots and lots of people who are working on data equity, who are working in your sector or in your state or in your country, or have a similar challenge that you do, and that there are lots of people who have been there and figured out something. So we also spend a lot of time sharing resources. So that's why we do Talking Data Equity. And if this is your first time here, welcome. If you are a regular from way back in the day, thank you for keeping it coming. There's a wide variety of what we do here in Talking Data Equity. Sometimes we talk about something that's very, very technical, kind of very advanced statistically. Sometimes we kind of go back to basics, because going back to basics is usually incredibly important, whether you are a beginner or an expert. And sometimes we have very, very cool special guests. Today, we do not have a special guest. Today, you are going to get me, and which means we are all going to have to pitch in and ask some questions. And I am going to be talking about a topic that a lot of you requested. And if you're wondering, where can I request a topic? Where can I say what I want to talk about? It is right here. Oh, thank you for saying I'm special. That's very nice. That is very sweet of you. I appreciate it. Why can I? Okay, so I'm actually going to stop sharing my screen for a second, because for some reason I cannot see the waiting room, and there are lots of people in the waiting room. Here we go. All right. Great. Now I'm going to share my screen again and be able to let people into the waiting room at the same time. There we go. I'm so out of practice being the special guest. Yeah, so if you're wondering, oh, people asked for this topic, I have a topic, I have a problem that I want to talk about, that I want to get advice on. How can I ask questions? And I put in the link our main Talking Data Equity page. And that page includes a couple of different links. It includes a registration link, which is what you should do if you want to make sure that you get the calendar invite and the Zoom links. It also includes a link to suggest a speaker, and it includes a link to suggest a topic or ask a question. So feel free to submit your ideas, submit your requests. If you want to be a speaker for Talking Data Equity, you could submit yourself. That is no problem at all. And this is a really, really widely and repeatedly requested topic. It even came up in the chat in the last two things that we talked about. And the topic is, what are we going to do about gaps? And how can we think about measuring gaps and analyzing gaps and displaying information about gaps with an equity lens? So that's what we're going to talk about. And like usual, I'm going to present with a couple of slides. Feel free to put questions and comments into the chat at any point. You do not have to wait. And then after I'm done a couple of slides, we're just going to open it up and anybody who wants to unmute themselves can. Okay, so the purpose of my slides is to kind of ground us in a little bit of common language and walk through some of the things to think about. And so the first thing, whenever we get a topic, is what do we even mean by this? What even is a gap? Why do we hear about equity gaps so frequently? And why are some people really uncomfortable with the idea of equity gaps? Essentially, when we're talking about a gap, what we're usually talking about is a difference between two things. And a really important question is, when does a difference become a gap? When does a difference become an equity gap? When does a difference become a disproportionality? And when does a difference become a disparity? These are really the four words that are commonly used. And I always find it really helpful to kind of go back to basics and think, what do we actually mean when we say these words? Because that helps me figure out, is that what I am trying to say? Or have I just developed a habit of kind of using words that I hear a lot of people around me using? We're going to talk a little bit today about when a difference becomes a disproportionality. Actually, I'm going to back up one more slide. A gap really can be thought of as a difference between two things. An equity gap is usually when we think that difference is not good news, and that it represents some sort of social process that is creating a difference, some kind of marginalization, some kind of different access to opportunities. That's usually what we mean by an equity gap. There isn't an official definition that everybody agrees on. But the way that we're going to measure these gaps and decide if they're equity gaps and things like that comes down a lot to what's a disproportionality, what's a disparity. And disproportionality has to do with when we compare proportions. So if a proportion of a community belongs to this group, and a proportion of people that are having a specific experience in that community belongs to this group, we can compare those two proportions and see if they are the same or similar. This is done a lot in education. This is done a lot in health. This is done a lot in economics. However, we need to be really, really careful in how we interpret a disproportionality. We only really want to think of a disproportionality as for sure a bad thing when we want to back up, when we want to align ourselves with the assumption that everybody wants the same thing. And I see this happen a lot when there's a difference that actually probably isn't a disproportionality. It probably is a sign that people want different things. So we need to be very careful. So for example, a disproportionality, can be measured in a school district by collecting race data from the children, the students in that school district, and then comparing proportions. So I am not showing you data from a real school district. This is synthetic data. So let's say that the proportion of children in this school district who are Black is about 15%. And the proportion of the children in this school district that are white, just above 70%. And then we want to compare what proportion in this school district who like strawberry ice cream are Black and who like strawberry ice cream are white. You can see that there is a big difference here. There's a much higher proportion of students in your school district who like strawberry ice cream than there is a proportion overall in your school district. So this is a disproportionality. Is this disproportionality an equity problem in terms of people who like a certain flavor of ice cream? I'm not here to tell you that this is or is not a problem. I am here to tell you that that's the question that you need to answer for yourself, because sometimes it's not a problem. And of course, sometimes it requires some further investigation. We're looking at the same numbers. I haven't changed the numbers on the slide here, but I've changed the labels. What if instead of the proportion of students that like strawberry ice cream, we're looking at the proportion of students who are in special education classes in this district? So is that disproportionality a problem? Again, that is not an easy answer. We're going to talk a little bit about the unique cases of thinking about things like special education. We're going to talk about that in a minute, because sometimes we might say, well, it's quite bad that there are more children in our district who are Black and in special education than there are the proportion of students that are Black in our entire district. That shows that Black children are being treated differently. And that might be true. But we need to think about what special education is designed to do. Special education is designed to be supportive to somebody who has a different set of needs. And so if in our community, we know that Black students are being treated worse, that they're experiencing marginalization, they're experiencing racism, they're experiencing oppression, giving them additional extra support at school might actually be a good thing. I'm not saying it is a good thing. I'm saying we don't want to automatically always interpret every difference as an equity difference. And we don't always want to interpret every disproportionality as a negative thing. These are the questions that we need to stop and ask ourselves. Now, again, this is the same data, different labels. This time, we're looking at a disproportionality in students who feel a sense of belonging. Now we're getting to a disproportionality that is probably much more straightforward to interpret as a problematic thing. We probably can assume that the vast majority of students want to feel a sense of belonging in the school where they're attending. And if it's very disproportionate, we might want to look at what's happening. So that's a series of things to think about when we get to a disproportionality situation. More common, though, is a disparity situation. A disparity is different than a disproportionality in that it's not usually comparing a proportion of a population to a proportion of a population that's having an experience. A disparity is usually just comparing an outcome by group. Disparity is almost always what we mean when we're talking about gap scores. If there are gaps in an outcome, we're usually talking about gap scores. So yes, every difference is not a disproportionality, but lots of differences are disproportionalities. Some differences are disparities. So what makes a difference a disparity? From an equity point of view, in general, a disparity is considered to be a difference or a gap that exists due to an equity problem, due to a lack of access to resources, a lack of access to opportunity, experiencing oppression, experiencing discrimination, similar things like that. A disparity is not, in equity data projects, is not usually considered to be a neutral thing. Okay. So why does any of this matter? Can't we just count up the different outcomes, look at how it's going for the groups of people that we care about, compare and contrast different things, and roll out some reports? No, the answer is no. We cannot do that through an equity lens. There's a couple of reasons for that. Very, very, very smart people that are working in post-secondary education, including Dr. Ben Simmons and Dr. Spiva, have been Oh, I'm going to really pause for a second. And because somebody's saying they're hearing a lot of audio feedback. Are other people hearing a lot of audio feedback? Somebody on video, give me a thumbs
No.
up if we're okay. Okay, you're okay. Okay, because that would be very annoying. Okay, thank you very much. I don't want to keep going if there's audio problems. All right, fabulous. So Dr. Ben Simmons and Dr. Spiva have been doing some really good work, which we'll link to in the forum, talking about the fact that if we focus on equity gaps, in other words, comparing outcomes for students in group A to outcomes in students in group B, and leave it there, like descriptive gap analysis, descriptive disparities. That can, in many senses, open the door to encourage stereotyping. You've also heard our DataViz friends, Eli Holder and Peter Blakely, talk about how doing that in visualization also encourages stereotyping. And it also drains resources away and drains attention away from paying attention to where the onus to change needs to be. Continually drawing attention to descriptive disparities can draw attention and resources away from root cause analysis, what the system is producing, what the practical processes are that are producing these gaps. So we're not in any way saying we should never display these gaps. But what we're saying is thinking that we have to display these gaps, thinking that displaying these gaps is the first thing that we should always do is not necessarily the best choice. We've really seen this as well in terms of the coronavirus and how people reported on the data that absolutely showed that people who were experiencing racism were more likely to get COVID, more likely to die from COVID, people who were being denied access to healthcare, people who were being denied an opportunity to work from home. All of these things were causing more COVID, and all of these things were being experienced by people who were Black, by people who were First Nations, by people who were Indigenous, by people who were Latina and Hispanic. So how that was reported sometimes worked really well, sometimes was a little bit, blaming towards the people that were experiencing racism. And we're now starting to see research come out that continuing to double down, continuing to highlight descriptive differences, descriptive equity gaps in what was going on during the COVID pandemic, actually reduced a feeling of the need for change, reduced the motivation for people in positions of privilege to change policy and practice. So this really resonates with what we've already seen in the problems with visualizing without paying attention to uncertainty, visualizing group differences, and doubling down on reporting equity gaps over and over and over in areas that we already know disparities exist. We'll put links to all of this in the forum. So the first thing I wanted to say, because a lot of people were saying we want to stop reporting gaps, period. And so I don't think that we should make a rule that says we should stop reporting gaps, period, or that we should always, first thing you have to do is break out health outcomes or education outcomes or employment outcomes or income outcomes. A rule is never going to get us to data equity. We always have to stop and think, okay, who is this data project being developed for? What's the usefulness of this data product? How is this data product trying to create change? And is showing some disparities, disproportionalities, and other ways to collect and display information about gaps in alignment with that purpose. It simply cannot be more simple than that. We're going to have to stop and ask. And if we decide we do want to display some measures of differences, disproportionalities, disparities, other types of equity gaps, what are a couple basic choices that we want to make sure we pay attention to, and again, align those choices with the purpose of our project? And we did lots and lots of research and curating of some resources, and we'll share lots of these resources with you. And we're pretty sure that the first 6 choices you should pay attention to after you decide if you should display gaps or disparities or not, and you decide you're gonna, are: first, what's the reference point? Second, what kind of differences matter? Do absolute or relative differences matter? 3, all social groups are going to be in different sizes. How are we going to account for that? 4, which is really interesting to me, do we care about pairwise comparisons or a summary approach? 5, are we going to give extra emphasis to specific social groups? Is that in alignment with our project? And then lastly, how are we going to draw attention to the root cause of whatever it is we're showing? So those are the 6 choices that we think you should start thinking about if you plan to display some differences. And I'm going to quickly show you a couple of examples, and then I will turn it over to the conversation that is quite actively happening in the chat. And don't worry, we will absolutely share links to all of the resources, and some of the resources are paywalled. We will share PDFs for people who can't access the paywall. So first choice is the reference point. And the reference point is basically, what are we comparing? And this is a really common question that people submitted. You folks really wanted to talk about this in Talking Data Equity. Like, we don't always want to compare everybody to the privileged group. Because if we compare everybody to the privileged group, we're creating analyses and visualizations that are just doubling down on norming whiteness or norming maleness or norming wealth. And that's exactly the opposite of what we're trying to do. So how do we possibly think about using a different reference point? So there are a couple of ideas that we have. This is, again, not an exhaustive list. This is a couple of examples of things that we have done in the past. Let's say that we're trying to find out how satisfied the patients that are using our health clinic are. And we have average satisfaction rates broken out by race and ethnicity. And these are just 4. These are not all the race and ethnicities that exist in this data collection. They are the 4 that I'm going to show you for the purposes of this illustration. One option, if you don't want to, so one of the things that we're trying to avoid here is just saying the white experience is the normative experience, and we're going to compare the Black, the Hispanic, and the Asian patients in our health center or clients in our health center to the white experience. That's what we're trying to avoid. We're trying to avoid using the dominant experience as the reference point. So one thing that we can do is we can calculate the average of all of the people using our health clinic, and then we can compare different racial categories to that average. And a couple things to say: there are lots of different ways to calculate an average. You can calculate an average by putting everybody into a pot. You can calculate an average within racial groups and then take an average of that average. You can weight in different ways. There's lots of ways to do this. So you'll have to think of which way is good for your project. And the second thing I'll say is you don't have to display every single racial group every single time. It depends on the purpose of your project. So this is one thing that you can do if you want to avoid comparing everybody to, in this example, the white experience. You can use the average. Another thing that you can do is you can compare. You can set kind of, instead of setting a benchmark for the top, you can set a benchmark or set the bottom of your visualization at whoever is, sorry, I'm just gonna mute that. You can set your baseline at whoever is the least satisfied. You can say, okay, one of our groups of clients is the least satisfied group. And there are 3 groups of clients that are more satisfied than that group. And what this does is it highlights who is being given preferential treatment. Instead of highlighting who is underachieving, quote unquote, because that's not what we believe, and that's what we're trying to avoid showing, or who isn't getting a good outcome. We can highlight who's being given preferential treatment, who is having a better than average experience, and how can we make adjustments based on that? How can we take the practices that are being applied to these groups and apply them to the other groups, or how can we redistribute resources? Again, this is not a chart you have to use. This is one of many options, depending on the purpose of why you're looking at gaps to start with, why you're looking at differences to start with. Of course, another option is you set up a meaningful benchmark. You actually decide what your goal is. Rather than saying our goal is white people, we say our goal is whatever it is. What's a reasonable satisfaction goal for all of the patients that are using our health clinic? What percent of patients do we think should be highly satisfied? You're not going to reach 100%. That is not how humanity works. And so we should pick a number that we think is meaningful for us. And then it's possible to show how the different groups of people are doing relative to that benchmark. So this is pretty close to a conventional gap analysis, but instead of comparing everybody to white, we're comparing everybody to a meaningful benchmark, and we can see the relationship to a benchmark rather than the relationship to a normative privilege experience. Last thing I'm going to show you is maybe because we're talking about how satisfied our clients are by race. What we're actually trying to understand in this data project is how good a job our health center is doing at treating our patients equitably. That's what we're trying to understand. And so we're trying to assess our health clinic. We're not trying to assess our health clinic's clients or patients. And so in this case, we don't actually need a pair by pair comparison. I don't need to know exactly how well this race of clients is doing compared to this race of clients, because what I want to know is how good of a job is my clinic doing? And so in that case, we wouldn't do a pairwise. We would actually just compare the gap. We can compare how well is the least satisfied group compared to the most satisfied group. And I don't need to name the groups for the purposes of this specific project. And I can see, oh, we have a 41 percentage point gap. Our health clinic is not delivering equitable care. We need to do better. And one of the things I really like about this is that these groups can change, and the measure is still valid. So because this is a summative measure, this is an overall measure about how our clinic is doing, the specific groups can change over time, and we don't lose the validity of this measure. And so this can really help us if we're moving towards like a targeted universalism approach. Okay. So again, I am not saying that one of these is better. I'm saying these are at least 4 alternatives, and I bet you can think of like 40 more that you can still talk about differences without having to say, this is how everybody compares to the dominant experience. And you can avoid doubling down on those stereotypes that we're hoping to avoid. Okay, that was the longest thing I'm going to talk about because I think that's probably the most practical. Second choice is, do you want to measure absolute difference or relative difference? That's going to be really different from project to project. Absolute difference, if we're looking at the non-Hispanic Black rate and the white non-Hispanic rate, the absolute difference is subtracting these 2 lines. This space here, absolute difference. Dividing these 2 lines, the ratio of these 2 lines, relative difference. So depending on what you're trying to measure. Accounting for group size. This is super important when you are trying to compare the outcomes of a little group and a big group. And again, we've talked a lot about the responsibility you have when you start dividing people into groups. So we're not going to do that here. But if one of your groups is really little, this is an issue. This is an issue, especially if you're going to use p-values or other forms of weighting to decide if that difference is real. Most statistics will tell you that the difference between a little group and a big group isn't real because one of the groups is little. This group is the difference here, the disparity, the gap here is quite big, and it is real, even if it has a big p-value. So make sure that you are thinking about how you're going to take into account small groups compared to big groups. Pairwise versus summary approach. I'm not going to read out this whole thing. I'm going to share these slides so you can see them. Bottom line is pairwise is, if we go back to my client satisfaction example, do we actually want to know how each of those groups of people compare to each other? Or do we want to know that last thing, how well is my health clinic doing at creating equity in a summary kind of a setting? Different answers for different questions. This is the summary approach, which sometimes is more useful because it puts the onus to change on the organization or the system that is making the choices, that is producing the equitable or not equitable outcomes. There are, I think there needs to be more use of summative measures of equity rather than the stereotypical kind of one-by-one gap analysis. Differential weighting, when you're doing gaps and you're looking at disproportionalities or disparities, it is fine. It is not a scientific crime to pay more attention or weight certain groups differently if they are the focus of what you're trying to do. If you are trying to correct for past injustices, it is not unscientific to build that into the math that you're doing. That is not a science crime. Last thing I'm going to talk about is, okay, you're going to show these gaps. Choice number 6 is, how are you going to pay attention to how those gaps got there, how those root causes got there? How are we going to avoid creating stereotypes in education that certain people, they just aren't smart, and we have 400 years of graphs to show it, right? Like, we don't want to do that. So I'm going to show you 2 examples of things we've done in the past. Of course, in the United States and Canada, we have a very serious problem with racism around maternal health. There's a huge disparity in the likelihood of childbirth mortality for a birthing person who's Black and a birthing person who is white. This gap is going to double down on stereotypes. The gap is really big. One of the things we can do is explain that gap. When we visualize this gap, whether it's in a report, whether it's on a dashboard, whether it's in a social media post, we can find data that tells us what is the economic environment structural gap that is contributing to this. What's the housing structural gap that's contributing to this? Healthcare, social environment, physical environment. We talk a lot about the social determinants of health, which are super important, but are kind of slipping into being used as stereotypes these days. These are the structural determinants of health. We can include that in a gap analysis. Also, this is back to the special ed that we started with. You don't just have to look at one gap in a journey. Almost everything, whether it's education, health, criminal justice, the corporate sector, somebody going through your customer acquisition funnel, measuring whatever gap you're going to measure at many different times can really help you use your gap assessments to move the needle on the things you care about. We're not going to be able to make any decisions if we look at that Black versus white gap about who gets enrolled in special ed in our district. That's not going to be nearly enough information. We need to know what the difference is when students get referred for evaluation, what happens when they get evaluated, what happens when they get recommended, and what happens when they get enrolled. So that's another way to do gap analysis if you don't have the kind of tangential information to fill in the gaps with some root cause analysis. Okay, I'm going to leave it there. Again, we'll share the slides, we'll share the videos. Number one, think carefully before you do gap analysis. Second, if you decide that it's still a good idea, because lots of times it is, we don't want to stop developing evidence that says these disparities are a problem. We need to put money here. 6 key considerations to make sure that what you do is equitable. I am not going to share that. Those are like super technical. I'll put those technical slides up, but I'm not going to go through them now. Honestly, they're too boring. We don't need to talk about it. Let's talk together now. I know there's a lot going on in the chat, so that's what I want to do. I will stop talking and let you folks talk. But I do want to say before anybody leaves, there is no Talking Data Equity next Friday. So that's March 17th. No Talking Data Equity, but we are back the next Friday, March 24th, with a special guest, Howard Shee, who's the director of data for an organization called AAPI Data. Very excited about that. Okay, so let me stop sharing my slides so that you can see each other. And if you are in the room and you want to ask a question, go ahead and raise your hand. And I will also look at my curated list of questions in the chat. Mish, hey Mish, go ahead.
Happy Friday.
We made it.
I want to loop back to the the benchmarking and the I really like how you approach the disproportionality. The work that I do, and I kind of want to bring this up because it gets tricky. I liked how you showed the different sections. One of the things I look at if my variables are subjective or objective. And so referral is always subjective, and recommendation is more often than not subjective. And then we often think that, well, the test is objective because everyone does the same test. But this is where I add context. So I often try and start with mapping too, so that I can get a sense of context. So does anyone in the room know what drapetomania is? It's okay, you can put it in the chat if you know what it is. It was a medical condition, a mental health condition that was conferred to slaves who ran away. And so I bring that up because when we, in particular around education, when we assume that more kids are going because they have a higher need and we don't understand the social context, so we don't understand policy, we don't have a clear idea of the time and place, what's happening in time and place. And then we have to kind of go backwards and see how we got to time and place. I wanted to bring that up because we can't really do good disparity work if we're not looking at how everything kind of works together in concert and thinking about that. So I just wanted to bring that up because that's kind of what I do. I'm a puzzler and I look at what are we missing. And so some of the things we're often missing are what's baked into rules and
sorry, I didn't
and structures. So
I have my phone on the charge and it's behind me, so I didn't have.
Oh, that
Sorry,
was
Mish,
cute.
go ahead.
No, that's okay. So I really appreciated that. And so I liked the gap. I think that where you landed with doing the gap is brilliant because it doesn't call anything out and it focuses on what you're actually trying to do. And then in the background, you can start to untangle the patterns. So I really appreciated how you got to the nitty-gritty. Thank you.
You're very welcome. And I look forward to learning a lot more about, can you spell that word? Yeah, if you can put it in the chat so everybody can copy and paste it, and we'll definitely be doing some Talking Data Equity on that because that's cool. All right, we're going to go to the next person who's got their hand raised. But before that, I'm also going to highlight a very important question that's being asked repeatedly in the chat and also being answered very effectively in the chat. But I want to make sure everybody sees it because the chat's really active. If we don't name the groups in a disparity or gap analysis, how will we ever know how to do better? And there's a perfect answer in there, which is there's a difference between naming something internally and naming something publicly. You can do all kinds of analysis internal for your organization that you would never be able to publish for privacy rules. You know, you can't expose individual people. but that inform your internal strategy, inform your internal stuff. I mean, that's really legitimate. That isn't being performative about your equity. As long there is no problem with doing an analysis that is very nuanced, that you keep internal to guide your resource allocation, your strategic plan, and then you can easily publish like this is our health clinic's equity score. You know, we're at a 41% gap. That's not great. We have specific initiatives that we're working on, but we're not going to name them because we want to keep the focus on the onus to change on us, not on stereotyping a bunch of people who are already experiencing oppression. So equity is really tricky because just like in probability and statistics, some of the stuff that seems really intuitive that we should do has an unfortunate unintended consequence. Okay, thank you for waiting. Alfonso, hey, how are you?
Yeah, thank you very much. A great discussion, Alfonso Rodriguez, and with the CDC. Kind of following it, obviously, it's not one option that's going to fit every need, but the one I've been frequently finding myself is that, for example, the population I'm very interested in becoming visible frequently is ignored, and when identifying what I would consider to be what are the population with the greatest disparity, right? Because you can have disparities by different ways that you slice the pie, by race, ethnicity, pregnant woman versus not pregnant woman, people in corrections, people in, and what I see frequently is that many programs have a tendency to say, okay, I have addressed the disparity by race, ethnic groups, maybe Latinos or Blacks, so I'm done. And in many situations, for me, for example, my population of interest are immigrants, suffering huge disparities, even compare much greater that you have a difference by race, ethnicity, is by US born versus non-US born, even within racial ethnic groups. And I all the time screaming, but what about this even bigger disparity that you have here? There is nothing being done about. So do you have any suggestion about, there is no about fighting. Obviously, somebody's working a pregnant woman, somebody's working, and everybody's competing for funding, but any suggestion about how to identify the population with the greater disproportional burden? So at least there doesn't mean that the other ones will be neglected, but at least that we don't forget the most neglected among the most neglected communities. Yeah. Thank you.
Yeah, that is a really, really good question. And frankly, that question is a question that falls to the profession of ethics, not to the profession of mathematical statistics. So I'm not really going to be like, this is how you would fix that. But because it is a question of ethics, right? This is a question that economists and bioethicists are really struggling with, right? Like, should you consider the most important need where there's the most number of people who have like a moderate need, or is it where there's a small number of people, but they have an extreme need and that need is being perpetuated, you know, by this other group? You know, this is a really, really deep and important question. And the way that we work through this with the work that we're doing, because you're right, there are so many different disparities that exist and different ways to measure disparities that exist that you can, you know, pop up the disparities that are most interest to you. For us, the way we do this work is by, at the beginning, before we even look at the data, we make sure that the project scope includes what is the purpose of this project and whose lived experience are we trying to focus on. And so in your case, if you're doing a project that is trying to develop evidence that centers a lived experience of somebody who's an immigrant, the first thing that we would do is talk with or look at the research on what are the greatest drivers of long-term problems for the people that we're trying to center. And then we're going to go and get data based on that, because you're absolutely right. Once you have data, most of the deeply important decisions about what matters and what success looks like have already been made.
Yeah, but sorry, quickly, I think it's also a data issue because we are used to look at these disparities separately. Okay, this is the disparity by race, ethnicity. this is by pregnant, this is by X. But
Right.
I haven't seen a place where you put all these different ways of looking at these disparities, and then to say, okay, where the population based on these proxies that have the greatest disparity, and is the because of the pregnancy with this. So that's what I, besides doing multivariate analysis, that's what when we look at separate, that's kind of what I've seen that I haven't seen really a good way to compare this different to say, okay, this is the one that we need to, all of those are important, but this one the most disproportionate. So that's what I think is also a piece of the ethical, I think is also, a data visualization or a data analysis that it would be great to have some, some guidance. Thanks.
Yeah. Okay. Okay. Totally agree. That this is an ethical and a mathematical issue for sure. Totally agree. And yeah, multivariate analysis is the best way I know of approaching that. I put into the chat so that you can see, and we'll put a link as well in the resources. One new type of analysis that's new to us, I don't think it's that new to statistics in general, is something that's called meta-analysis. And it's being used to do intersectional health equity analysis. And also it's now being applied in the education sector. And that is one way to look simultaneously at the combination of all the different types of things you're talking about. It doesn't have to just be demographics. It can be demographics combined with social determinants of health, combined with structural determinants of health. And it kind of is a way to maximize some of the characteristics of a multi-level model. So it has fixed effects and random effects. It's not perfect. There are some pros and cons, but I'd look into that. We're hoping, like, one on my bucket list is to do an analysis or two like that with some data we're working on, and we'll let you know when I. It's really good to see you here, Alfonso. Susan, go ahead. Thank you for waiting.
Hi, thank you so much for this presentation. I was really learned a lot from your examples. I love the way that you described the gap analysis and kind of refocused attention on the contributors, the structural and systemic contributors to the gap, like an infant mortality graph that you showed. My question is, if you have two groups, but my population of interest is people with disabilities, and this is, we don't have all of the data, maybe perhaps not as much data as we would have for racial or ethnic groups. But what I'd like to do in reporting findings of health disparities is to point to the structural contributions to those disparities to prevent people from saying, of course, they have health disparities, they're disabled, because there are systems of oppression that contribute to those differences. My barrier is that we don't necessarily have measures on economic instability or some of the other outcomes tied specifically to the health outcome that I'm interested in. My question is, if I can pull together those disparities in other related to other outcomes, can I say that generally we know that people with disabilities face huge structural determinants, huge inequities in housing and employment and education, and we presume that these determinants are related to the health differences that we do have data on?
My opinion, which is all I can give you on this, is resoundingly yes.
Okay.
That resoundingly, that is exactly what my suggestion was that was forming in my head when you were kind of asking your question. And the only time you're going to run into a problem with that is when you're not being honest about it. You know, if you were going to pretend that this was, you know, a complex causal analysis that proved without a shadow of a doubt that this one thing was causing this other one thing, yeah, you can't do that. But there's no problem at all. Even if you think back to the visual that I showed that showed the structural things, you could tweak a chart like that to make it look a little less deterministic. You know, you could say these are the 5 structural determinants of health that we think are filling in. I mean, we're lucky in that particular case that that's a very well-funded piece of research. That's very unusual, that chart, being able to create that chart. You could certainly
Yeah.
create a little bit less, making a little bit softer claim and saying, here is the economic difference that we know is happening in this population. Here's the funding gap. I don't know all the different gaps because I'm
Sure.
not a subject matter expert, but instead of just exactly saying, this structural thing is 20%, this structural thing is 40%, you could absolutely fill in with, statistics on the gaps that people who have disabilities are experiencing around housing, around employment, and show what they are and say, we think this is connected.
Brilliant. Thank you.
Yeah, I'm really happy that you're doing that work.
Thank you. I'm really happy you're doing this work.
Thank you. Hey, Bob.
Hi, I had something kind of similar. I was working for a mortgage insurance company over the summer, and we were working on something called convergence for next summer, setting up a template for the Philadelphia area. And the whole convergence title is Closing the Income Gap. And it was basically the part we were working on is the biggest piece to that puzzle was home ownership. And it was in mortgage insurance. But the gap I want to talk about is a different type of gap, is gaps in the data, because it became a legal mandate to list your race and ethnicity when applying for a mortgage. And then that changed in the late 2000s. We're like, well, you don't have to if you apply for a mortgage online. And so 25% of our data was missing. But clearly you could see that people could have the same debt to income ratio, the same loan to value, that all this other stuff. But there was a huge disparity in race and ethnicity, and it was unquestionable. But it, like, to say, well, normally you would say, oh, 5-6% of the data is missing. It's like 25% of the data is missing. And I guess my question is, have you come across this? And this in an equity thing, we were trying to bucket it. We're like, well, a black buyer will tend to buy in a black area and a white buyer will tend, but can't. And like we were looking at the Asian, and there were patterns of like what race and ethnicity would buy a home in what area. And we
Yeah.
just weren't coming up with anything that was palatable. I
Mhm.
guess it was really tough to bucket that and to weight it. I was wondering if you have any experience with that.
Yeah. So are you saying specifically, you were trying to figure out, was there any way to predict or guess or
Yeah, because we could get
impute
it down to the
the
census
missing
tract
data?
level. Like we just didn't know, like the loan initiator, what race or ethnicity they were, but we know where they were about to buy and
Right.
what the income level and the stuff. But I think, when you're dealing, especially with it on an
Yeah.
equity basis, it's a different thing than saying, height or weight.
Oh,
It's
yeah.
and so it's very touchy. And like what I was doing this 6-month project there, and it never
Yeah.
resolved when I left. But I'm still curious as to how would you deal with that, like in an
Yeah.
equity standpoint.
So that's a really good question, and very happy that you asked it. And a couple of things. First of all, yeah, with an income gap analysis that is trying to assess the relationship between race, ethnicity, and housing in the US. Again, this is a place where we have a tremendous amount of documentation that this whole system is steeped in racism. And so we know for sure that racism is going to be causing differences here. And if you're missing a lot of data about race and ethnicity in a system that is operating according to racist principles, you're going to have a very hard time. I would agree that almost any of the predictive algorithms that are probably on the market right now for commercial use are basically just going to be doubling down on stereotypes. And I would assume that the only reason to be doing this analysis is to see if progress is being made, to see if there are any policies or strategies that can actually work. Most of your data came from Census HUD and internal data. Yeah. So I would be very, very careful at trying to impute missing race and ethnicity data because it's steeped in racism. And instead, I would try and find ways to do the analysis that you're doing, because it's going to be a fairly complicated analysis, using a statistical method that is well designed for a lot of missing data.
Yeah, and what's
Because
interesting though,
predicting that's not going to work
it's
out.
like we kind of intuitively before we looked at it, we're like, well, if you're a minority, they probably have a higher percent of not disclosing, but that wasn't so because it was
No.
all over the place.
Yeah,
And
you really
so,
can't make that assumption. That's the who does and does not disclose is very different for different sectors. Okay, we have to leave it there because one of the promises that we make at Talking Data Equity is that we will get you back out on time so that you're not running late to whatever is coming next. I have had a lovely time talking with you all today. We will put up the slides, we will put up the references. I know we didn't get to a lot of questions in the chat. Maybe we'll need to do gap analysis part 2, but you can put the questions into the community forum. Feel free to go into the community forum and ask questions. We will answer you for sure. We are not here next Friday, March 17th, St. Patrick's Day. If you're in certain parts of the world, we are off. So we will be back. We'll be back on the 24th, and we have a fabulous guest from AAPI Data, going to bring some something they're just releasing, a piece of research that they've just finished. So it should be publicly consumable by then. I know this hour went by so fast. Yes, I see the requests for gap analysis part 2. Okay, so we'll do gap analysis part 2. Save up your questions. Have a great rest of your Friday and have a great weekend, and take care. Look after yourselves. You're very important, valuable people. Look after yourselves. See ya soon.